Welcome to your most favorite channel, Heartbeat. My name is Dr. Amrit Kejriwal. As a student, I say most of the teaching will be digitalized. Hard copies of books will become obsolete. They will be replaced by soft copies. Lectures and lecture halls will cease to exist. They will be substituted by videos and online classes. Practical classes will remain in medical sciences. We have to prepare ourselves for a revolution in learning and teaching methods in all disciplines. Today we learn something about lifestyle modification, blood pressure and diabetes. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. So blood pressure and diabetes, these are the two lifestyle diseases, and there are many ways we can control them. We have to control them very well because they lead to further complications which affect the other systems. So each is a risk factor for the other. It affects various body organs such as the heart, brain. Lifestyle modification is similar in both. What we mean by lifestyle modification is change in day-to-day habits. Self-management is the key to control, and we learn this under various headings such as reducing weight, exercise, regular health checkups, controlling diet, quitting alcohol, quitting smoking, cut caffeine, manage stress, and get support. These are the various ways we can do lifestyle modification both for blood pressure and diabetes. So weight reduction. This is one of the most effective ways. Target is 1 kg per week. So losing 10 kgs gradually may reduce your blood pressure by 10 millimeters of mercury, and it may help to control diabetes. Check your waist girth. If the male waist is greater than 102 centimeters or female waist is greater than 89 centimeters, you are predisposed both to blood pressure and diabetes. But it varies from race to race. You must do exercise regularly. So brisk walking about 30 minutes per day, 5 to 6 days per week is usually considered to be sufficient. Exercise should be done regularly. You can do walking, jogging, cycling, swimming, dancing, gardening, weightlifting, or play sports. Some of the patients, they have arthritis and are not able to do walking, jogging, or cycling. Such patients I generally recommend swimming or do exercise with the arms while sitting. Some people are not able to spare time in their busy work schedule, so you can go to the office by walking. If the office is close by, you can go cycle to office. If you're staying in a building, you can climb up the stairs, or if your office is on third floor, you can walk up the stairs instead of using the lift. If you're catching a bus to office, go to office, catch the bus from the next stop or get down one stop earlier. So in your own day-to-day schedule, you have to adjust your own work so that you can be able to get time for exercise without interrupting your schedule. Go for health checkups. So check blood pressure and sugar regularly at home. If it is high, check more frequently, and if required, visit the doctor. If the blood pressure and sugar are acceptable, then the visits to doctors may be reduced. Get a health checkup done annually. For diabetics, HbA1c every 3 months. Eye checkup every year. Protect your feet. Look out for heart disease, and in diabetics mainly the gum and tooth loss. And look for skin infections. Control your diet. I already put a video on diet in diabetes, what we're supposed to eat and not to eat. So for blood pressure, you decrease the sodium in diet. No added salt. By no added salt, it means that if you're taking salad, don't add extra salt to it. Substitute food and beverages with low salt diet. Avoid salty food items such as pickles and papad. Decrease intake of processed food. Processed food contains a lot of salt, and gradual reduction of salt may be helpful. Control your diet. So whole grains, fruits, vegetables, and low fat dairy products are helpful. Increase the potassium intake in the form of fruits and vegetables. If you're eating out, follow a healthy plan. Limit your alcohol. So 1 to 2 drinks per day may be beneficial. More quantity, protective effect is lost. May reduce efficacy of antihypertensive drugs. And it will also increase blood sugar if alcohol is being consumed. Avoid binge drinking and drink alcohol very slowly. Dilute alcohol with diet soft drinks, so the calorie intake will be reduced. And avoid drinking on empty stomach. Quit smoking. Blood pressure remains high for several minutes after finishing. Quit smoking will help the blood pressure return to normal, and it will improve your life expectancy. A cigarette is defined as a flame burning at one end and a fuel at the other. Caffeine. It may increase the blood pressure in patients who take it occasionally. However, it does not affect blood pressure in patients who take caffeine regularly. Reduce your stress. Chronic stress increases the blood pressure, so eliminate stress. These are modifiable factors as eating unhealthy food, alcohol consumption and smoking. So these will all help to reduce your stress. Then you list all your causes of stress: work, family, finances, illness. Try to find out how you can reduce each one systematically. So if your stress is due to work, talk out with colleagues. If you have family stress, talk out with the families. Avoid stress triggers, example people or traffic. And you plan your day, focus on the priorities. And of course, all people are not the same. Some people can manage the stress, some people cannot. And many problems can be avoided by talking calmly, and if required, do yoga or meditation, and this may help you to reduce your stress. Get support from family and friends. Occasionally on social media or in your locality, you may get support groups who are helpful. Join support groups.